This is Transmission Interrupted, the podcast series from NETech, the National Emerging Special Pathogens Training and Education Center. Welcome to Transmission Interrupted from NETech.
Hello, and welcome to Transmission Interrupted. My name is Jill Morgan. I'm a nurse here at Emory University Hospital in Atlanta, Georgia. For those of you not yet familiar with NETech, our mission is to set the gold standard for special pathogens preparedness and response across health systems in the U.S., with the goals of driving best practices, closing knowledge gaps, and developing innovative resources. NETech works alongside and in cooperation with the CDC and is funded by ASPR, the Administration for Strategic Preparedness and Response. And today we are talking about spring break fever. I have it bad. I hope other people are really looking forward to a wonderful spring break. And we're going to talk about two perspectives on vacationing safely. How do we avoid coming home with some unexpected illness from wherever our spring break might take you? And today I am joined by Dr. Henry Wu, Associate Professor in the Division of Infectious Diseases at Emory University School of Medicine, and is the director of Emory TravelWell Center. I'm also going to be joined by Dr. Laura Dickson, who's an associate professor in the Department of Microbiology and Immunology at UTMB in Galveston. So thank you guys so much. And we're going to launch into this with Dr. Henry Wu and really talk about sort of, even at the very beginning of thinking about vacationing, the things I need to consider. What do I need to be thinking about if I'm thinking about the beach or thinking about camping? What are the risks I should have in my mind that I want to consider in this decision making?
Well, thanks, Jill, for having me here. Yeah, I think that's a great question. As we plan our trips, we're often thinking about where we want to go, which countries, what we'd like to do. And I think that's a great place to start. What we often forget is the other considerations, like planning for your hotel, your flights, your pickups. You should also consider that maybe where you're going may have additional health risks that we don't typically encounter here. And this can apply potentially to any travel, but obviously when you're leaving the country, particularly going to parts of the world that are either more tropical than where you're currently living, or maybe lower income parts of the world where there may be more infectious diseases or less hygienic conditions, there can be some important things to be considering. So I think a great first step is to look up the country you're traveling to and look up what some of the health issues are. And a great resource is the CDC's Travelers Health website, where you can look up a specific country and see what kinds of infections and other health hazards may be present. Also listings of travel health notices, and that might be very specific outbreaks or situations that may make a country more risky. So I think that's a great place to start when you're planning your trip.
Yeah, it seems so overwhelming now. I think while we have so many 24-hour news channels and we get our news in bites on our phones all the time, we may not be aware of what's going on in other parts of the world, especially when it might be something that they encounter all the time, but that's foreign to us. So I didn't even know that the CDC had a website specifically for that. I think about the U.S. State Department has warnings, but I think that has more to do typically with like unrest or civil unrest. But nice to know that there are places that we can look to for that information. So are there things that I actually need to do? Like thinking about, I'm vaccinated for all the things I encounter in my work at the hospital, but are there other things, like if I'm thinking about traveling someplace perhaps more exotic or more tropical, are there vaccines I should think about?
Potentially, yes. Many parts of the world have infectious diseases that are really not endemic here in the U.S. or things that we just don't see very often, and we may not be routinely vaccinated against them. So again, the place to start is to see the recommendations from CDC, and if there are recommended or potentially even required vaccines, which occasionally, particularly in the situation for yellow fever vaccine, there may be requirements in certain parts of the world. You really do need to check in advance, because these are not things you can do the day before you travel, or it's obviously not ideal, and better to plan ahead to get these vaccinations. And certainly a good place to go is a travel clinic. like ours that specialize in preparing travelers. We review the vaccinations that are recommended and required. We can administer the vaccines. We also can help you sort out other things, such as the need for prophylactic medications for malaria. And in certain parts of the world, malaria is a very prevalent infection. It can make you quite sick. There is no travel vaccine for malaria, so that's a lot of what we do. We also give plenty other basic advice on how to avoid infections, whether it's sticking to safe food and water and using proper bug repellents. Many of these infections we're talking about are passed by mosquitoes and ticks. There's plenty of advice that we can give you. Now, certainly your primary care doctor can do a lot of this. Most countries do not require highly specialized travel vaccines, and so it's quite possible that you can get fully prepared through your primary care doctor. And certainly if they decide that you need to see a travel specialist, they can help you arrange that.
All right, so let's see. If I'm going someplace super exotic, and I would consider if I have to cross the Atlantic or the Pacific, I guess, to get somewhere. If I'm on the continent of Africa, I might need to think about really planning ahead far enough that something like a vaccine for yellow fever or my malaria prophylaxis could really be in place before I ever travel. But for, let's say, the more, I hate to say routine, but as I would love to go to the Caribbean, but the places that we think of routinely for spring break type travel. So thinking about the Caribbean, thinking about Mexico, what are the things that we need to think about, or even the infectious diseases that we need to think about that might be in those places and off of our radar?
You bring up a great example of the Caribbean. Certainly a lot of Americans are going there. The good news is for many Americans, you don't particularly need extra vaccines, particularly our younger adults and children. They routinely get certain vaccines like hepatitis A in their childhood series. That would be one of the highly recommended ones. But we should also point out that, yes, these tropical countries in the Caribbean do have other infections, particularly mosquito-borne infections such as dengue fever, which rarely is transmitted within the U.S., but in only certain areas. But it's become quite a problem in the recent decades in much of the tropical world. And in the past year, we've seen an increase worldwide of dengue fever cases, both within the countries as well as in travelers returning from them. In our clinic alone, we've seen several cases of dengue fever returning from very even short trips to the Caribbean in resorts. So these were folks who were just taking your weekend vacation and not necessarily going off the beaten path, not camping, not living with locals. They're just going to your all-inclusive resorts. So they fortunately generally do okay. Most cases of dengue fever are not going to be severe, but certainly they will all attest that it was not a fun experience to have attached to your vacation, to have infection that causes high fevers and body aches and can take some time to recover from. So I would encourage folks to always watch out for mosquito bites, particularly in these tropical areas. And dengue would be the most common infection in many of these places. So even if there's no malaria, there is reason to be very careful about avoiding mosquito bites. Beyond that, certainly a lot of these countries, even in the nicer resorts, may have hygienic levels that are not as good as what we are accustomed to here in the U.S. So taking some precautions of what you eat and drink is always good. And of course, the routine or more common sense advice was to always be careful, particularly when you're in the ocean and doing a lot of activities you don't typically do here at home. And if you do, be mindful of all these things. You can help make this a really great vacation.
Yeah, the last thing I would want to do on vacation is end up really ill. And certainly we hear about things that, as you mentioned, with food safety, and people are, I must have gotten food poisoning from something. And frequently, of course, it might just be that we're eating a lot of different things that we're not used to eating, but certainly the risk of food poisoning or something like hepatitis A is always a possibility. I want to go back to something you mentioned about mosquito bites, because I know this year I've heard a lot more about dengue than I ever have before, but it seems like in the last maybe decade, we've had some other pathogens that I had never heard of, like chikungunya and Zika. Where are they now? I mean, they sort of fell off maybe just my radar, but I wonder about, what is the status with those kinds of diseases, and do I need to be concerned about them as well? And how would I even know?
Yeah, these are Great questions. And I'll add one more name to the list. The newcomer is Oropouche virus, which has been emerging in South America. And we've even seen outbreaks outside of South America in Cuba. And it's tough to keep track of all these viruses. You bring up Zika, chikungunya. These hit the headlines over the past 10 or more years. And the good news is they're not quite as prevalent as they were when they emerged. However, they are still out there, and we do get reports of outbreaks. These three viruses, dengue, Zika, chikungunya, are all passed by the same mosquito vectors. These would be Aedes mosquitoes, which are present worldwide in tropical and temperate areas. So the risk of reemergence of these things, even if they have not been detected recently, is always possible. There are some pointers here, since they are all transmitted by the same mosquito. Bug repellents are going to be always your first line of defense against all of these. So I think it's important to keep that in mind. With chikungunya, we actually do have, as of now, 2 approved vaccines. A new one just recently was approved. We don't have it in clinic yet, but we've had another vaccine for the past year or so. Now, the vaccine's not for everyone. Since chikungunya is not the most common infection right now, we don't routinely recommend it for all travelers, but it's something that could be considered. Zika virus, we don't have a vaccine for. Fortunately, the numbers of Zika cases among Americans has been quite low recently. But of course, we are particularly concerned about it, particularly for pregnant women, because of the risk of birth defects and pregnancy complications. Oropouche, the new virus I mentioned, is actually not typically transmitted by mosquitoes. It's actually transmitted by small biting insects called biting midges. So something that I was not that familiar with until this came out. But again, the good news is bug repellents help repel bites from all kinds of bugs. And so that would be your main line of defense against that.
Gosh, it's like lions and tigers and bears, like biting insects and midges and ugh. Thinking about a couple other things that I know that people have heard about and maybe have no idea how you avoid, but things like bot flies. Like people hear about this. I think it sort of in some ways harkens to some sci-fi movie where something's erupting out of your skin. But do we really have to worry about that? And how do I avoid something super icky like that?
Yeah. The bot fly, or the more general term, cutaneous myiasis, is something that we occasionally see. And these would be fly larvae that are burrowed in your skin and develop there. It's very unpleasant, even if it's a superficial infestation of sorts, but very unpleasant. There's actually a few kinds in the world. People often do present. I believe they're presenting with the sort that is actually from a larva or an egg that's deposited by a mosquito. So some of these flies are very tricky, and they can actually use the mosquito to deposit their larva onto your skin where it further develops. And so it goes back to bug repellents, I think. Now there are other forms, particularly what they call the tumbu fly in Africa, where how you get it is a little different. The eggs are often on the ground or laid on clothing that's been left out to dry outside. And so when you come into contact with that, either through walking, barefoot or with uncovered shoes on the ground, or if you are hanging your clothes out to dry and then you wear it, that's potentially how you get that on your skin, and the potential, cutaneous myiasis in the process. So tips against that is, of course, covered shoes. And if you're traveling into the tropics, usually a good idea to dry your clothes in a dryer if possible. And if you have to hang your clothes out to dry, most locals will advise you to iron your clothes to help eliminate that possibility.
Wow, things I had never even thought about before. I mean, I want to avoid mosquito bites because I don't like the itch, and they just, of course, are annoying. But the thought that I could end up with stuff that's burrowed into my skin is just almost too much to bear. That's really horrible. So that's a really good reason to wear bug spray, or to have like long pants and long shirts, especially when I might be in an area that's, I think, especially thinking about the weather and whether it's a particularly heavy mosquito season someplace. And I know that changes a lot based on whether storms have just come through or something like that. So really good advice to be very proactive in avoiding the bites so that you can avoid, the list now is, flies burrowing into my skin, dengue, malaria, yellow fever, Zika, chikungunya, and Oropouche. So, that's just not even, I'm sure, the full list, but that's, I think, reason enough to be a little concerned.
Yeah, I absolutely. And in all honesty, I pick up my tropical medicine journal every month and I'm reading about things I've never heard of before. Now, it can get overwhelming. And this is the way I look at it, rather than not be so worried or scared of all these things that I'd never leave my house, which is certainly not my goal. We run a travel clinic because we think travel is important and really a great way to enrich ourselves. The key point is to be aware of risks and take the basic precautions, which will protect you against the vast majority of things I can think of. And so I do think travel can be very safe and you can enjoy your trip and not be paranoid or scared about everything that you might catch. I mean, the reality is, if you we're worried about everything in life, then you probably shouldn't get in your car and you probably should just stay at home. So given that we are all would like to get out and interact and explore the world, I think we can definitely do it safely.
Yeah, I think that's a great message, because I certainly agree. I am going to go on vacation, but I'm going to try to be reasonable about it and say I'm not going to take risks that I don't need to take. And so that will mean making sure that I've got my little insect repellent wipes with me so I can hit my ankles or my wrists or the back of my neck or wherever I know will be exposed in these situations when I'm out walking or whatever. So, Henry, if we've been on vacation, we perhaps have been to the Caribbean or we've been on a cruise and we come back home. Are we in the clear? I mean, is there anything we should worry about that might show up later? Or if we develop symptoms later, like at what point do we sort of make that decision of this could be something that I really need to get treatment for?
Yeah, that's a really good question. And the reality is most infectious diseases have an incubation period that's at least a few days and often more than that. So if we're talking about viral infections passed by mosquitoes like dengue, the typical incubation period is somewhere between 5 to 10 days, and sometimes a little bit less or more. But the reality is long enough that many cases will present after you get back, especially if it's a short trip, a weekend trip. There are interesting examples of infections where the incubation period is longer, and malaria is a good example where malaria cases can present weeks and sometimes even months after exposure. So this is really important advice we give to our travelers. It's that if you are sick after your trip, and even if it's been some time after your trip, you should seek medical attention, particularly if you have fevers. So virtually all the serious infections I can think of present with high fevers. So fevers are a good sign that you should see a doctor. And even though there may be a high chance it's something that you may just catch here or something less more mundane like COVID or influenza, if you've traveled even in the last few months, I think it's a good idea to check in with your physician and also to make sure they know where you've been. Because if they don't know where you've been, it may not occur to them that you may be at risk for having malaria. Or if they don't know you were in Cancun last week, they may not think to bring up dengue fever. It's quite common for physicians to see so much flu and COVID, and the usual cough and colds that they aren't thinking of these more unusual things. And routinely letting your doctors know about recent travel or even travel in the past year is not a bad idea. In fact, when we see patients for sick visits in our clinic, I'm asking where have they been in the last year and sometimes even more.
Wow. No, I think that's great advice. And I like the idea that what we might be exposed to that could make us sick, there could be a time gap right there. We might not associate it in our own minds even, but remembering to mention this when we seek medical attention, to say, yes, I was on this cruise last week, or I was in, South America 6 months ago. Those might be significant. I'm really not sure I would have thought about that. The other thing that you mentioned that I think is so key that I was thinking about, of course, vector-borne illnesses for this episode, but I'm glad you mentioned influenza and COVID because I don't want to get those on my way to vacation. So I think thinking about, while I want to make sure I don't need to get any special vaccines or prophylactic medication before I go somewhere, I also don't want to end up sick by the time I get there. So I want to make sure that I'm still doing those really common sense things I think a lot of us got into the habit of doing during COVID, but maybe our attention has dropped off, like good hand hygiene, having a mask with you so that if you happen to be standing in that jetway and somebody's coughing and hacking, you can at least protect yourself. And certainly if you're the one who feels the cough coming on, that you're wearing a mask to protect the people around you. So I'm really glad you mentioned common stuff is common, and we want to avoid those as well.
Yeah, thanks for pointing that out. I actually often tell folks in my lectures that COVID shots and influenza vaccine are travel vaccines. If you look at the most common infections travelers return with, it's actually not dengue fever or typhoid fever or polio. It's the common stuff like influenza and COVID. And obviously, it's because airports, crowded areas, these are all common places to get exposed to these viruses. And many travelers who come to our clinic do not routinely get these vaccines, even though they are routinely recommended. But when we discuss with them the reasons to consider it before their trip, they often do it. And it's for the reasons you mentioned. Who wants to get the flu while they're on vacation? Who wants to potentially bring flu to their grandparents' birthday party? And finally, as I've alluded to, who wants to come back and get flu afterwards with a high fever and end up needing testing for dengue and malaria? Because I'm going to do that if I see somebody with a high fever who has been to places endemic for that. So it will certainly make your life easier, and certainly even if you are at low risk for complications from these infections, you could still benefit a great deal from getting vaccinated before your trip.
Yeah. I think of the long-term effects that some people have had with COVID, but also that people have from things like malaria, where not everybody just gets over it, and it can become something that really can be sort of a lifelong burden. And I think what's being called long COVID is certainly something that most of us would want to avoid, even if we feel like, we're healthy enough that it's not going to put us in the hospital or put us on a ventilator or kill us, hopefully. But that doesn't mean that we couldn't have some sort of long-term effect from these things. So definitely worth avoiding.
Yeah, on that long COVID example, you bring up an interesting a point in that when we started seeing cases of long COVID, a lot of us recognized the syndrome as being very similar to prolonged conditions after other infections, and particularly dengue fever often leaves folks who have recovered with prolonged fatigue, hair loss, symptoms that are similar to what folks with long COVID complain about. So I think there are many similarities, and all the more reason to try to avoid all these things.
Yeah. Well, I'm grateful to say that I think we also have a lot of smart people working on these things. And I think that we hope that kind of research will be able to continue in the future. And I think we do want a vacation, and we do want to do it safely. And so making sure that we're taking the actions we can take. There's an awful lot about travel that's outside of our control, whether you're late or weather has changed or all sorts of things can happen that can screw up even really well-made plans. I want to do what I can to avoid any of these things that we've talked about, a high fever, having influenza or COVID or anything else on my trip, and certainly avoiding the biting insecty things while I'm there, and then coming back and feeling like I don't have to worry that if I get a fever, it could be any of these diseases that might have long-term effects. So, gosh, there are a lot of good reasons to just be super careful. And I think to consult someone as smart as Henry Wu, or to check with the CDC website, the State Department website, figure out what the risks are for where we're going, and make sure that we're doing what we can to stay safe. All right, Henry, anything else you really want to drive home for people about spring break and how to stay safe and enjoy their vacation?
If I could mention, the current infection of the day has been measles here in the U.S. Certainly there have been outbreaks of measles, and we are putting a lot of effort in our clinic to make sure travelers are immune to measles wherever they're going, because certainly there is now risk even in the U.S., and this is an airborne infection. Not everyone is fully protected, and really it's the population that may not have gotten 2 doses of measles vaccine. And so it's really the older adults. Now, if you're old enough to have actually caught measles when you were a kid, and those would be those born before 1957, we don't worry too much about them. But there is a cohort of American adults born later than 1957, but also old enough to have missed out on the routine 2 doses of MMR that all kids now routinely get. So that would be a good thing to check with your doctors about before you head out overseas.
Wow, yes. And that's actually a great advice, even if where you're heading is within the United States. We know that measles is on the rise, certainly here, and it has been on the rise in some of our other countries around the world. So I think it's great advice to remember that something that we probably didn't have on our radar for a long time, like measles, might be the source of a great deal of discomfort later if we end up with it. So yeah, I think about whether I'm on an airplane or I'm just visiting family in another part of the country, I need to be aware of stuff like that.
Absolutely.
Excellent. Well, thank you so much, Henry. What a pleasure to talk to you. I hope that we haven't scared anybody away from a tropical climate. I know I'm still going to go to Cancun at some point soon. And I hope that other people are able to enjoy a vacation while making it as risk-free as possible with good proactive measures like bug spray and long sleeves and avoiding places that might put me at greater risk.
Yes, thank you for having me here. I hope everyone has a good spring break.
Well, thank you so much, Henry Wu from Emory TravelWell. And now I'm really grateful to have a mosquito expert, an actual mosquito expert with us, Laura Dickson, who's a PhD in the Department of Microbiology and Immunology at UTMB in Galveston. So, Laura, thank you so much for being with us and talking more about pathogens and mosquitoes and bad things that happen to us when we get bitten. So thank you and welcome to Transmission Interrupted.
Absolutely. Thank you so much for having me.
Absolutely. All right. So I realized that I know that a bee has a stinger and, what is it? What do you call the thing that is biting me when a mosquito bites me? That little needle-like thing is a what?
Yeah. So the female mosquito has a proboscis, which is exactly what you just said, a needle-like appendage that will puncture through human skin and into a human capillary to imbibe or drink blood from a human host. And it's specific to the female mosquitoes, and the male mosquitoes don't have them. And female mosquitoes require us to complete their life cycle. So we may just think of them as being a nuisance as they're biting us, but actually we're doing them a favor by helping them complete their life cycle by taking a blood meal.
Wow. Well, I have to say, it wasn't the thing of nightmares until you described it quite that way. But imbibing in my blood from my capillaries in order to complete their own life cycle does make it sound a little like they are, I don't know, some sort of vampire. I mean, I suppose that's where people get that idea, right?
Yeah.
All right. So this idea that mosquitoes are transmitting these pathogens that Henry talked about, right? We have all sorts of things. Some of them I've heard of before, and some of them Henry gave us horrifying new information about, between yellow fever and dengue, chikungunya and Zika and malaria. But where is that in the mosquito? How, what's going on at the sort of mosquito biology level that makes mosquitoes part of that life cycle of a pathogen?
Mm-hmm. Yeah, mosquitoes play a very active role in transmission of these pathogens. We, again, tend to think of them as just something that's annoying and biting us, but they're absolutely essential in the transmission of these pathogens. And so if an infected individual, say, is carrying dengue, and a mosquito comes along and bites them, that mosquito could become infected with dengue. And it's not enough for the mosquito just to take a blood meal from this infected individual, but that virus then has to enter the mosquito's body and replicate in the mosquito's body and find its way out of the mosquito's gut back up into the mosquito's salivary gland. And this process can take a matter of days or a matter of weeks, depending on the virus. So for example, for dengue virus, this can happen within 7 days, although that's quite short. It usually takes around 10 to 14 days for the virus to find its way back into the mosquito's salivary glands, so that when the mosquito decides to take another blood meal, it then can spit the virus back into the next human host. And so the stages that the virus must go through to get to all of these different organs and back to the mosquito's mouth parts is quite extensive, and it faces a lot of hurdles along the way.
I do not want you to make it sound like I should be rooting for the mosquito here, because that was horrifying.
Yeah, the virus must pass all of these barriers before it can be transmitted again to the next host.
So it's not just dirty proboscis problem. It's actually like this whole complex cycle within the mosquito.
Correct. Yeah. I mean, it's been documented before in the lab, and I'm sure it happens occasionally in nature. We call that mechanical transmission. If a mosquito has virus particles on its proboscis from biting one infected individual, and then it immediately goes and bites another individual, it's possible that some of those infectious virus particles could make its way into that host. But by and large, a majority of transmission is occurring through an infectious cycle of the virus within the mosquito and going through all of these different organs and tissues within the mosquito host.
Wow. All right. So yeah, that was really disturbing. Okay. Got a lot to think about here. All right. So now thinking about mosquitoes and mosquitoes being, to me, sort of ubiquitous. I live in the South, so therefore we have mosquitoes not quite year round, but it seems like we're getting close. But are there different places that have different kinds of mosquitoes? Do we need to be more cautious in certain locations or certain times of day? What's sort of the landscape, both temporally and geographically?
Yeah, absolutely. There's thousands and thousands of different types of mosquitoes, but really only a handful of them are going to be transmitting diseases to us. And those ones that have this special relationship with these human pathogens that they transmit exist in different locations. They bite during different times of day. They have very different life cycle stages and where they're laying their eggs and how they're developing. So, for example, if you take the mosquito that transmits dengue virus, this is a highly urbanized mosquito, Aedes aegypti, that thrives in urban environments and can maintain epidemics in these urban environments. But other mosquitoes, like Culex species, for example, that are transmitting West Nile, they exist more in a peridomestic or more in a semi-urban, maybe semi-agricultural type setting. And again, these different species of mosquitoes are biting at different times of day. So you have to take all of this into account when you think about mosquito-borne virus risk.
Okay. So, as I said, I'm here from Atlanta, and therefore we have mosquitoes almost year round. But, here we are talking about spring break and what you might not want to bring back from spring break. So people will be traveling to places that are warm and tropical, whether it's now in spring break or over the summer months to come. And so for people who aren't used to sort of that environment for mosquitoes and the kinds of mosquitoes that might be there, does somebody from Michigan need to worry that the mosquitoes they're going to be in contact with in Mexico or Puerto Rico or wherever are different and could carry different things than the mosquitoes they're used to at home?
Yeah, so the mosquitoes that you're going to find in these tropical climates are going to be very different than those that you're going to find in the northern US. You will find some of them in southern Texas or in Florida, but a lot of cases of, say, dengue, for example, that are brought back to the US can't be maintained in local transmission cycles. And so the mosquitoes that were used to biting us in our backyard in Michigan are not going to be the mosquitoes that are going to be biting you in tropical locations. Those mosquitoes are by and large probably going to be Aedes aegypti or Aedes albopictus.
Okay, so even if I say, well, I've never really had a problem with mosquito bites. They don't itch me too much. I'm not bothered by them. That doesn't mean I shouldn't take precautions when I am someplace different, someplace perhaps tropical, because it's not just a nuisance. It's more than a nuisance. It's the potential for all these other pathogens.
Correct. Yeah, you need to be thinking of mosquitoes not as something that's just annoying you as you're trying to sit outside, but these things are transmitting very harmful pathogens to you. And precautions need to be taken, such as wearing long sleeve shirts or long pants when wearing insect repellent and being especially aware of the time of day. So a lot of Aedes mosquitoes will like to feed right at dusk. So as you're thinking about what to wear as you go out, as the sun sets for dinner, be thinking that would be a key time that these mosquitoes are going to be coming out and biting you.
So we're not just going to dinner. Mosquitoes are coming out for dinner as well.
Exactly.
Okay. Wow. This vacation is not sounding like a very nice vacation at all. All right. So I need to wear long pants and long sleeves and use an insect repellent, even if I'm not used to being bothered by mosquitoes because the kind of mosquitoes I might encounter in tropical locations can and do transmit a lot of things that I just do not want to bring home.
Yep, absolutely. And if you're traveling back in the US to a region that does have these mosquito species, so like in regions of parts of California or Texas or Florida, you can give these pathogens back to the local mosquitoes and in some cases start little outbreaks within the US because we have those correct mosquitoes in those locations.
Wow. There's a lot to think about that. Okay. If as a mosquito expert, I just love this. As a mosquito expert, is there something you really fear or wish to avoid from a pathogen standpoint? Like of all the things we've heard about, all these different things that mosquitoes can give us, like what's to you is the worst?
Oh, that's a tricky question. I think for me, one of the scariest mosquito-borne viruses is Eastern equine encephalitis, but that's here in the U.S. in the Northeast. That's not something we're going to be picking up on spring break.
Okay, well, that's one good thing about spring break then. Unless I'm going on spring break to what, Michigan or something, or Maine or
like Connecticut.
All right.
That area. Yeah.
There's nowhere safe.
There's nowhere safe. Yeah, there's mosquito-borne viruses are almost everywhere. Yeah, but if ones I'd be picking up in a tropical location, I would say, I don't know, dengue scares me. I've never had dengue. It doesn't seem particularly pleasant. If I was a pregnant woman, I would be very concerned about picking up things like Zika or a new emerging virus, Orapooch, which is mostly transmitted by midges, but it can rarely be transmitted by mosquitoes as well. So I think that's also something to consider as well, is if you are pregnant or if you're planning to become pregnant soon, of what types of viruses are circulating amongst mosquitoes in these regions.
Yeah, I had the term baby moon was new to me a few years ago when we were in vacationing somewhere and somebody said, "Oh yeah, so this is your honeymoon." They said, "No, this is our baby moon." Where and I was like, "Oh well, that's probably more information than I wanted to know about you." But congratulations and good luck on making a baby. All right, so there aren't any safe places. While there might be worse times of day, there are no guarantees that mosquitoes won't be just out wherever you are, whenever you're there. And there are worse places to travel, perhaps, because there are mosquitoes in these places that have pathogens that we really don't want. Although, as we said, there are some other things across the United States we don't want from mosquitoes. So avoiding biting is number one priority. Now, in our household, we have an argument going, and I would love to get your answer to this. Are they good for anything? Is there some reason I shouldn't or wouldn't want them just eradicated from the planet? I am not somebody who gets bitten very easily. Here at my house, at least, my husband is the one who seems to be particularly tasty to mosquitoes, and he would love to wipe them off the planet. Why shouldn't we do that?
Well, I would counter that argument of what good are we for the planet? Just because we don't have an obvious role doesn't mean that we don't serve or haven't served at some point some important ecological niche. And so, yes, while it's tempting to eradicate all mosquitoes, like I said earlier, only a handful of mosquitoes are actually transmitting disease. And by and large, most mosquitoes aren't transmitting diseases. And they are an important part of the ecosystem. They're a food source for bugs or other bugs and birds and bats. And without them, a lot of these other animals would be missing their food source. And it'd be very difficult to preferentially eliminate specific mosquito species, although possible.
Okay, so we need to just sort of get used to this idea. I did see some fascinating stuff lately about somebody creating little lasers that are able to pick out just female mosquitoes and zap them in the air, but I'm not going to count on having that at a resort somewhere. So I need to count on my own long pants, long sleeves, and bug repellent.
Yes, and also loose-fitting clothes also are a good mosquito repellent as well, as opposed to tight-fitting clothes. Loose-fitting clothes will help kind of keep them off you as well.
Okay. Well, I think that's great advice. All right. So Laura Dickson from UTMB, mosquito expert, I'm going to leave it with you to give me just any other information or messaging you would like to extend to people who are thinking about traveling for spring break or other reasons to lovely tropical places?
Yeah, I think it's just important to keep in mind that mosquitoes aren't just a biting nuisance, that they really are carriers of these very severe and consequential pathogens that can make us really, really sick. And so whenever you see a mosquito, don't think about them as just wanting to be there to bite you and bug you, but they're actually there capable of transmitting pathogens to you.
So worth taking seriously.
Absolutely.
All right. Well, thank you so much. I mean, this has just been such a pleasure and an eye-opening lesson in mosquito biology and anatomy. And I really have a lot to think about and bug dope to buy. So thank you so much, Laura, from the Microbiology and Immunology Department at UTMB in Galveston. We really appreciate having you here with us to finish up this episode with Henry Wu about spring break fever and all the things we don't want to bring home from some very nice location. So thank you.
Yep. Thank you for having me.
All right. Well, for those of you listening at home, thank you for tuning in for this episode on spring break fever. We hope you'll join us for future episodes on a wide range of topics, from healthcare worker safety to personal protective equipment, my personal favorite, and even more about infectious diseases of all kinds. If you have any questions for NETEC or ideas for future shows, please feel free to contact us at info@netec.org or find us on the web at netec.org/podcast, where you can subscribe to future episodes and find more information on today's topic. We'll see you next time on Transmission Interrupted.
You've been listening to Transmission Interrupted, the podcast series from NETEC, the National Emerging Special Pathogens Training and Education Center. Learn more at netec.org.